Well, good morning to everyone, and to our European guests, good afternoon. Thank you for joining us for this 60-minute webinar. I'm Kelly Barron. I'm an associate professor at the University of Utah, Department of Family and Preventive Medicine, and a senior associate editor at the journal Sleep Health. I'm pleased to moderate the session today, and we've invited guests from two papers. Dr. Devine is a lecturer in sport and exercise psychology at the University of Leeds in the UK, and her research focuses on behavioral decisions that drive physical activity. And so sleep is a relatively different area, and so I'm really excited to talk about the interaction of sleep and physical activity. Her paper she'll be talking about today is the influence of sleep and movement factors on mental health and life satisfaction during the transition to parenthood. The second paper we'll be discussing today is by Dr. Parsons and Dr. Young. Dr. Parsons is an associate professor at the Interacting Mind Center at Aarhus University in Denmark. The Interacting Mind Center is a collaboration between humanities, social sciences, cognitive sciences, biology, and clinical research. So super cool. Dr. Young is a visiting lecturer at King's College in London at the Social, Genetic, and Developmental Psychiatric Center. And she studies neural substrates of depression and anxiety. The paper they will be discussing is the beneficial effects of sleep extension on daily emotion in young adults, an experience sampling study. So today we'll have a brief presentation about each article and then take a question or two in between. And then at the end, we'll have time for general interaction and questions. So if you could please put your questions in the Q&A and I'll keep an eye on those. And as usual, mute your microphones, but I think those are automatically muted. I also want to point out that this recording will be presented after some editing on the Elsevier YouTube channel and also on the Sleep Health Journal website. Okay, so Dr. Devine, I'm going to turn it over to you now.
Great, thank you. Let's get these slides up. Hopefully we can see that okay. Okay, so yeah, as Kelly mentioned, we're talking about sleep and movement and how this affects mental health during the transition to parenthood. I do have some co-authors from both Canada and the US, so certainly like to recognize them. So if we think about transition to parenthood, it's often really a celebrated event, but it does bring challenges. Think about combining our new care responsibilities with other life obligations, such as career, other family commitments, and even your own health maintenance. So while it's a kind of joyous event, research has found that parenthood is really associated with increased psychological stress, more risk for mood disorders such as postpartum depression, reduced quality of life, and life satisfaction. So while we understand the demands of early parenthood may possibly reduce mental health, we haven't had a lot of research looking at how health behaviors may contribute to these trajectories. So that's kind of the point of the paper that we looked at, and we looked at two key health behaviors, one being sleep. So we also know that sleep is critical for our health, both physical and mental health. It's one of the most important things we can actually do for our health. And parents get insufficient sleep. Not surprising to anybody who is a parent, we don't sleep very much compared to the general population. And this sleep disturbance can begin during pregnancy and remains elevated postpartum for both mothers and fathers. And these disruptions of sleep can increase the severity of depression. It's really important that we get some sort of sleep when we have little ones. Think about physical activity. We know that physical activity has both physical and mental health benefits, including reductions in depression, anxiety. But we also know that physical activity in parenthood is reduced compared to the general population. So the aims of this study was to look at whether sleep and physical activity actually influence mental health and then in turn life satisfaction, as well as looking at the rate of change of mental health in that transition to parenthood. So we looked at couples without children, first-time parents, and those expecting their second child. So we had 157 couples between the ages of 25 and 40. 102 were not expecting a child. 136 were expecting their first child. And we had a smaller group of kind of established parents that are expecting their second child. And we followed people from baseline 6 months to 12 months. So if we think about our pregnant group, those expecting children, baseline occurred during pregnancy, on average just under 6 months of pregnancy, and then were measured again at 6 months postpartum and then 12 months postpartum. So their involvement in the study was a little longer than 12 months in total. And then couples without children were just assessed at baseline 6 months and 12 months. And at these points, we measured physical activity, mental health, amount of sleep, and life satisfaction. This is part of should probably mention, it's part of a bigger study that looked at a lot of different variables. And there's been a lot of published papers on some of the nutrition values, the physical activity, and other components. Obviously, this one is looking at mental health in particular. So we measured physical activity using accelerometers. So we did objective physical activity where they wore the monitor for 7 consecutive days at baseline 6 months and 12 months. And then sleep was assessed with the one item from the Pittsburgh Sleep Index, essentially asking to record the number of hours they get per night over the last month. And then we classified them as whether they met the guidelines for sleep or not of that 7 to 9 hours. Life satisfaction, we measured the life satisfaction with life scale. And this looks about what they feel about their life right now. Higher scores, better life satisfaction. And then mental health, we used the short form 12 part of quality life survey, obviously just using the 6 items for mental health, looking at social time, energy, roles, and mental health, like feeling calm and peaceful, or downhearted and blue. So just talk about what we did and how we looked at this data. This model looks at the parent status, so children, couples without children, new parents and established parents, and their activity levels and sleep, and whether this impacted mental health and physical activity. So to do this, we created 3 dummy variables and used 2 models. So the first model compared new parents and established parents for couples without children, and the second model compares established parents to new parents, and also couples without children to new parents, but we've kind of covered that within the first model. So this is a bit busy. The model is a little bit hard to read, but just to show you how we put it together so that we could use, in this case in model 1, the comparative or reference is the couples without children. So where we have positive values, that means our established parents are more active or getting more sleep than our couples without children, and negative values means they're getting less. So kind of the key takeaways from this is new parents are less likely to meet the sleep guidelines at 6 and 12 months compared to couples without children, and established parents are also significantly less likely to meet guidelines than couples without children. Perhaps not particularly surprising. And then if we look at the relationship with mental health, sleep at 6 months is positively related to mental health at 6 months, and then sleep at 12 months was positively related to mental health at 12 months, suggesting the more sleep we're able to get as parents, the more it benefits our mental health. And then mental health was positively related to life satisfaction at 6 months. So oftentimes when we run models like this, we have a temporal component where we take baseline values predicting 6-month values. In this case, because sleep disturbance can influence our mental health within a day or 2 of poor sleep, then we actually felt it would be much more realistic and likely that your sleep over the last month will affect your mental health right now, as opposed to your sleep 6 months ago affecting your mental health right now. So that's why the kind of temporal nature of our longitudinal path model is kind of occurring at the same time, if that makes sense. And interestingly, no relationship between physical activity and mental health for our established and new parents. If we look at the model 2, which takes established parents and compares them with new parents, and obviously we've already compared couples without children to new parents. So what this one shows is that established parents are significantly less likely to meet sleep guidelines at all 3 time points compared to new parents, and they're less likely to meet physical activity guidelines at all 3 time points than our new parents. And then lastly, sleep at 6 months is also related to mental health at 6 months, and same with sleep at 12 months, positively predicting mental health for at 12 months. And the other thing we did was look at how does mental health change in parenthood. This is again a really super busy slide, but just to kind of highlight a little bit of the model and that dyadic nature that we also looked at. So according to family systems theory, change in mental health of one person in the family can affect the other person in the family. We wanted to look at, does this change occur dyadically between partners? Turns out, at least in our data, it didn't. But we did find that across couples without children, new parents, and established parents, women had a significant increase in mental health over time with no change for men. Men tend to start at a higher level than women, but we do see an increase for women in mental health across all 3 parent status. So what does this really tell us? Results of the study really indicate that sleep is really important for new parents, particularly in terms of mental health. So some of our early research in general showed that the transition to parenthood is not discrete. It's not a one-time event. It occurs over a long period of time, and the stressors tend to remain. So these things can impact our mental health. So if we can increase sleep, we might be able to offset some of these issues. And importantly, reduced sleep was even greater for parents expecting their second child. So you have a newborn and you have a toddler, perhaps it's much more difficult to manage and to get that sleep when you need it. And then contrary to our hypothesis, of course, meeting physical activity guidelines did not predict mental health in this study. So likely because leisure time is impacted by having a child or possibly two children, and where time you spent doing physical activity may have been now taken up by caring responsibilities that you didn't have before. A couple kind of strengths of the studies have included fathers, which are often excluded from parenting health research. We tried to look at that dyadic patterns of mental health change, and obviously we use that longitudinal assessment, which builds on that correlational components. Some limitations of the timing of measurements during pregnancy. It's really hard to determine. While most people were on average just under 6 months, there was a range of 4 months to almost 8 months. So there's a big difference on comfort and sleep when you are 6 months pregnant to 8 months pregnant. So we could have seen changes occurring there. We only included heterosexual families in this case. It's quite possible that we would have seen dyadic mental health changes in a same-sex couple. It might occur differently. And the other thing that's kind of important is the sample is a bit different on physical activity and related variables such as income. So they're more highly educated, they have higher income, and we're more likely to have a normal weight than the average Canadian population. So some of the key kind of conclusions are, it might be very useful for, I think, okay, it's all well and good to say parents need to sleep more, but the reality is it's very difficult. Their sleep is impacted or say dictated by another human being, and they don't always have the choice, but perhaps some sleep education from practitioners to help them understand the importance of sleep, and perhaps prioritizing sleep over the dishes maybe or something else when child is napping might be useful, or other strategies like cluster feeding just to help parents get a little bit more sleep. Sleep ranged from 2.5 to 10 hours, with the mean sleep being about 6.25 hours. That's just under the recommendation. So it highlights that small changes in sleep are having an impact, but perhaps also small increases in sleep might have a benefit as well. And also because, well, perhaps sleep again is dictated by somebody else. For many parents, targeting physical activity in itself may actually improve mental health. So one of the reasons perhaps that physical activity didn't target mental health could simply be that parents weren't achieving enough moderate to vigorous physical activity to actually get those benefits. So perhaps increasing that when maybe you have a colicky child that you just can't get more sleep may actually help mental health as well. Okay. So thank you very much. I'm happy to take any questions if we have any at this stage.
Thanks. So if anybody has a question or two, go ahead and put it in the chat in the Q&A. And while you're thinking about that, I've got a question or two. Here's one that's coming. That was pretty fast. Okay, so one question. Since sleep disturbance, mental health challenges, and parenting are so intertwined, what suggestions do you have to address sleep disorders due to mental health challenges like anxiety, hypervigilance that are exacerbated by parenting, as opposed to those that can be addressed with sleep education, especially in the modern Western context of low family involvement and parental leave and that sort of thing?
That's a very good question, and probably beyond my capacity of knowledge in terms of the kind of the psychiatric or more psychological components, because some of that sounds a little bit more from the clinical side, and I'm not sure I'm the person to talk about strategies for that, because it's definitely a separate issue. If somebody is suffering from postpartum depression, while they feel tired all the time, they don't sleep very well. again, that's probably for somebody at a different.
And also,
Myself.
from my read of the article, that the measure of mental health was broad and not to a specific disorder in this sample. Did you
Yeah,
have
that's right. It was subjective mental health in this case. Yeah.
Did you have a sense of like any sort of clinically validated measure of like what percentage of the sample did have postpartum depression in the range that would be significant?
It'd be really hard to say because we really did just measure subjective mental health as opposed to like using the Beck inventory or something for depression. So we wouldn't be able to kind of classify people just based on the measure that we used.
Yeah, it looked like it was more of a measure of interference in life because of mental health than severity of the symptoms.
Exactly.
Next question. We'll take this last question, then we'll move on to the next presentation. But keep them coming in the chat and we'll pick them up at the end. Did you observe anything, any association between physical activity and sleep?
That's a really good point. Because yeah, we know obviously that physical activity can help with sleep. What we did look at that relationship, but it's not actually established relationship as much in parenthood because there's a lot of other factors that have influenced sleep that even if you are physically active, it might not improve your sleep. So it's not as an established relationship in parenthood as it is in the general population. We did have a quick look to see if there's anything there, and we didn't have a significant relationship because we were kind of curious if there was anything there as well.
I know, at least in my case, it was often a trade-off. Which one did I have time to do?
Exactly.
All right, well, thank you very much. And we'll come back to you, Dr. Devine, at the end. Now moving on, Dr. Parsons and Dr. Young will present on their paper.
Thank you very much, Kelly. Can you see my slides okay? Yes. Tired and Cranky is the subtitle of my presentation today, and it probably relates very, very well to the parents that Alison just alluded to. But I'm going to present a story of hope, and this is a very short-term sleep extension paradigm that we tested in young adults, so not parents at all. We're jumping to quite a different population here. Can I move forward? Now I can move forward. So while Alison talked a lot about the relationship between sleep and mental health, as sleep being a predictor of later mental health, in much of the literature, sleep disturbance has often been viewed as a symptom of mood disruption. So for example, if you have depression, the negative thoughts or the anxiety or those kinds of negative biases that characterize mood disorders may stop you from sleeping. But of course, as Alison mentioned, there's more and more evidence now that sleep can also precede the onset of mood disruption and impact your emotions. Much of the research in this field has focused on sleep deprivation paradigms, of which Parenthood, of course, is an excellent example. But sleep deprivation paradigms allow us to look at very precise amounts of sleep loss or sleep loss over time and test that in an experimental setting, for example. And much of the focus on this literature has been on negative emotions. And again, referring back to my title, this tired and cranky idea, we've tended to focus on the impact on things like irritability or sadness. And many of the studies have also looked at kind of pre and post paradigms also, which I'll come back to. And for example, a very typical setup in this field is to give people maybe 4 hours of sleep and then look to see at their responses to threatening stimuli. And the kind of classic finding is that adults on only a couple of hours sleep are more responsive to threatening faces, for example. So this is a way that really allows you to titrate and look at dose-related effects in quite a precise way if you look at sleep opportunities. But what about the opposite? And about 11 years ago now, there was a paper that came out looking at Stanford basketball players who were encouraged to extend their sleep. And these are college athletes, so they were asked to sleep for an extra chunk of time. And then they could look at their performance on, say, sprints and psychomotor, the number of basketball hoops I'm not a basketball fan, you can probably tell, but the number of shots they could take. And those parameters were improved with sleep extension. And they also measured some impact on mood, some improvements in the students' mood as well. And for a very long time, I wanted to do a sleep extension study related to this. And this is the paper that I will talk a little bit about further now. What we did, that's kind of novel aspect, was take advantage of the fact that most of us are walking around with really, really high-powered computers in our pockets, and that's our smartphones. And those smartphones allow us to send people messages at random times of the day and ask questions about your mood and how you're feeling. And that can be quite useful because if you think of, say, how you might feel at 5 p.m. after a dreadful, hard working day versus 11 a.m. after quite a nice cup of coffee, those moods and experiences and emotions might differ and might be quite transient at different time points. So experience sampling, one of the promises is that we can maybe capture a little bit more about your day-to-day experiences, really embedded within your life. In this particular study, we not only tried to measure the emotions you experienced, so we looked at positive and negative emotions, but also we asked a little bit about how people regulated those emotions. And what I mean by emotion regulation is the strategies that you might use to either dampen some negative emotions, for example, or distract yourself from a negative emotion, or for positive emotion, maybe to savor that. And Katherine Young, who is on the call as well, is really our expert on emotion regulation. So if you have any questions, she'd be very happy to address those. So in a nutshell, what this experiment did was we took a sample of short sleeping young adults. So we defined that as adults sleeping for less than 7 hours, which is really at the bottom end of the recommendations. And we had a relatively short experimental period. It was 2 weeks, which is extremely typical for experience sampling because people don't like to answer multiple items for much longer than that. It's kind of about the limit of what would people happily do for you if you're going to ask them about how they're feeling multiple times over the course of the day. So we had a baseline period, and then we randomized participants to either a week of sleep extension or sleep as usual. And the study was conducted at people's homes. And just to give you an overview of our overall setup, participants answered a bunch of questionnaires at home before they participated, had this 7-day free living baseline, and then our 7-day sleep intervention. We had 34 and 38 participants. And what we actually asked, before I move on from that, is we asked people to try and extend their sleep opportunity by 90 minutes. So it's a very, very straightforward instruction participants were given. And our results, we found that participants did report extending their sleep duration in the intervention week. And they did so by more than I actually expected, about 1 hour and 20 minutes in the sleep intervention week. And the sleep as usual participants continued to sleep. There were no differences between their sleep in the baseline week and in the intervention week, as you might expect. But interestingly, we also saw improvements, and this graph here is just from our sleep extension group. So not only did they sleep a bit more, but they actually reported that their sleep quality improved. And the bars that to kind of maybe draw your attention to are the green and the dark bars at the top. So that's the good and very good sleep. So in the intervention week, which is the bars on the right, our participants in the sleep extension group also reported improved sleep quality, which is quite, I think, a neat finding here. Emotion, which is what, I've stressed is so interesting related to sleep and experience sampling. We found that participants who extended their sleep had a slightly more positive daily emotion, and slightly less negative daily emotion. So the effect sizes weren't huge, but they were pretty consistent across our participants. And what I've presented here, again, Alison mentioned some busy plots. This one I think can beat most of Alison's as well because it's quite busy. But what is plotted out here is each of the days that people participated in, with the red being the sleep extension group, and they just went up a little bit for the positive emotion and down a little bit for the negative emotion. So a quick summary of our findings here. Short-term sleep extension, we concluded, was feasible in young adults who were reporting relatively short sleep loss, and we found small improvements in their positive emotion and small declines in the amount of negative emotion and they reported on a daily basis, and improved sleep quality. We gave people a possibility to either advance their, so go to bed a bit earlier or wake up a bit later, and we didn't give them any specific schedules. So we're quite interested to see what people would actually do, or would they just nap more? Now we didn't find anything specific, so it wasn't that everyone went to bed a lot earlier. Participants did both in this particular study. And I mentioned emotion regulation. We had no effects on emotion regulation, so no changes in the strategy use that participants were reporting to us via our experience sampling paradigm. So in conclusion, just to tie back to Alison here, when I tweeted about our study, a Mexican doctor who I know said, you know, awesome work, this is interesting, essentially, but the take-home message is not to have children. I'll consider it in my next life. So sleep extension, of course, my point here is not just to say that it's not possible for parents, but there are limited groups who sleep extension it may be particularly useful for, and our participant groups is young adults who are otherwise relatively healthy seem to at least engage in the short term with this. So I just wanted to acknowledge the people who helped on this, and of course my co-author Katherine Young, and I'm very happy to take any questions now.
Thank you so much. I love that tweet. That's so funny. So a question that I had while we're waiting for this to pop in was in terms of the selection of participants, you know, did they all know they were signing up for a sleep extension? You know, young adults, college students have a lot going on. So were they all willing to extend?
And Katie, you look like you're about to say something there.
Sure, yeah, happy to answer that one. Yeah. So we did recruit people, yeah, with the knowledge of that they might be randomized to a sleep extension group or a sleep as usual group. It was sort of, you know, minimal information as typical about our hypotheses and things, but of course we let them know upfront that we were looking for people who had shorter than average sleep duration and that they'd be willing to be randomized to one of those two conditions. So yeah.
And we did have some people drop out over the course, but our attrition rates were relatively reasonable, I feel. And our response rates for our experience sampling were also within the expected ranges too. So people seemed to engage at the level that has been previously reported in experience sampling studies. And also, I would say that the experience sampling component was probably the thing that would have caused more attrition rather than the sleep extension. But that's just me speculating now.
One area I find super interesting about sleep extension is just figuring out who can extend and for how long, and you know, and I thought one really great thing that you did in the paper that didn't make it into the talk was looking at the moderation of insomnia symptoms. And I don't know if you're able to, can you talk a little bit about the impact of insomnia? Because the average insomnia score was 15 or 14 in this sample, so it wasn't nothing. It was in the mild range on average.
Yeah. And as far as I remember, when we ran those analyses, again, we didn't recruit our participants with the aim of examining those specific. We didn't kind of think of that in advance specifically that we should incorporate a group that had high insomnia scores or high depression scores, but they did have those nonetheless. And Katie, can you remember the specific moderation directions there?
Yeah, so the moderation effect I think we observed was that those who had higher insomnia symptoms did show sort of greater sleep extension in the sleep extension condition. I don't know if that's the effect you were referring to, Kelly. So sort of suggesting, it's an intuitive thing. I think that those who have poorer or more affected sleep at baseline sort of have more room to move in terms of how they might benefit from a sleep extension condition. So if you have poor quality sleep, even this simple instruction to try and sleep a bit longer does seem to have a potential effect, and more so depending on perhaps how sleep deprived you've been or how bad your insomnia levels are.
Which it's a little bit counterintuitive based on the insomnia literature, because we do sleep restriction when people have difficulty sleeping. So a lot of times when we get patients in the clinic, they're spending more and more time in bed trying to sleep, and it's making their sleep more fragmented. So it's interesting, and this is a more mild college student sample, so you wonder if versus a clinic sample, so you just wonder if even just having to log their sleep every day and try to do something at all is that intervention is sufficient. And I do see that clinically too. There's a sample of people that come in, they're just so variable, and especially the young adults with these terrible sleep hygiene. If they just do a little bit, it goes a long way. With that, I'm going to open up the chat to just a general discussion, either study, and I'll be moderating. And so going back to Dr. Devine, there was one question about job schedules, income, sleep quality, mental health. Do you know anything about the occupation of the participants in your study?
Yeah, so we measured, to be fair, a massive amount of information from our participants. So we had things like time in job, so how much time per day, is it part-time, full-time, type of work, how much maternity leave or paternity leave they took, as well as support. So how much family or friend support they had. Did they have additional carers coming to help out? So we do have all that information, but we haven't looked at it yet in relation to kind of the sleep and mental health component, because there's a heck of a lot of information. And then we also run the risk of grouping our people perhaps a little bit too much, particularly our second or established parents, because we only had 76 couples in that sense. So the more that we kind of look at comparison between those who have support and those who don't, we are running the risk of influencing our power and our ability to actually detect effects. But perhaps there might be a way that we can look at it. We haven't delved into that yet, at least not in this paper, but there's quite a lot of information that we have.
It is a very rich data set. How much were the partners sleep related to each other? Because it's really, I think it's really unique to have a longitudinal study of both parents in the study.
Yeah, that's a really good question. I'm just taxing my memory a little bit here at the minute. I remember looking at, so we had the big extreme ranges of the 2.5 and the 10. So we had kind of had a cohort of couples that one parent, usually a mother in this case, had the low end of the sleep, where the father would have the high end. Then we had a big cohort as well, where they're kind of joint. So, or very similar, kind of that 4 or 5 hours, both of them were kind of getting that. So it really depends. And I imagine that depends on, or likely the case of how they decide to break up evenings in terms of, and the nights in terms of feeding, or whether baby will take a bottle at all as well, would be an impact of how much, let's say, dad could help out if the baby won't take a bottle. But I am just trying to take that off of memory. So.
That sounds like a super interesting study of the matching, the matching versus divide and conquer and that sort of thing. So a lot to analyze there. So some questions for Parson and Young about the sleep extension in general. There are some questions about how you did the sleep extension. Did you use logs, ActiWatches, and did anyone use medications to extend their sleep and things like that?
Yeah. So we delivered this entirely via our smartphone app, which meant that every morning people had a window to answer our sleep questions. And we took the items quite closely from the consensus sleep diary, so quite close to a sleep log. And so we did we were able to calculate things like the sleep opportunity that people had, and so subtracting time spent trying to fall asleep from the time you went to bed and so on. But we did just measure sleep via sleep logs, and we didn't have actigraphs. So that is a significant limitation here. Our findings do align well with other studies using actigraphs, but it's certainly a caveat. We didn't record anything related to medication, and whether they use melatonin or something like that. I suppose that might be one of the things that the question is referring to. Yeah. Is there anything else I've missed there? But I think for me the neat thing with using the smartphone based responding is that for many young people, the absolute first thing they do is check their phone, and that means that we are getting measures that are pretty close to when they've woken up, when it's the first thing that comes up. And I'm running a study at the moment, and I kind of called some participants and asked them what it's like to have those messages, or those prompts, and they said it's actually really, really nice because it's just done then for them. So it does, on one hand, that is how people interact with technology now, and it is such a proximal technology. And even if sleep hygiene wise, we prefer people to keep their phone out of their bedrooms, it's just the reality that the phones are very, very nearby, and therefore kind of good intervention, good tools for measurement in some instances. For sure.
So another question that we got in the chat was about looking at the day-to-day relationship that the experience sampling method lets you look at sleep to emotion, emotion to sleep. Have you conducted any of those daily analyses and looking at directionality of the effect?
I can answer that one if you like, Christine. Also just mentioning, Christine, you're still sharing your screen. Maybe it's a bit easier for the discussion to just to let you know. Yeah, so in this study, obviously, we were aiming to sort of causally influence sleep to look at the effect on emotion. So that was the main reason for doing the intervention here. We did do another study prior to this where we were looking at kind of day-to-day variations in sleep and emotion, which would have allowed us to look, at the bidirectionality. In terms of, when we ran those analyses, we didn't see any striking directional effects. But in that other study, what we did find, was that even day-to-day fluctuations in sleep patterns within individuals was associated with changes in emotion. And in that study, we also saw an effect on emotion regulation. Actually, particularly one emotion regulation strategy called dampening, which refers to the dampening of positive emotions, which is a kind of maladaptive cognitive strategy that's quite highly linked with depression. So when something good happens, you tend to have these negative cognitions that sort of dampen down your positive affect. So, something good happens and you think, oh, well, it's not going to last, this isn't for me, that kind of thing. And so quite surprisingly in that study, we found even sort of small changes in day-to-day sleep. So decreasing sleep and decreasing sleep quality was associated with an increase in dampening cognitions. So again, correlational there, not necessarily directional, but something interesting to see there that didn't pop up when we then, went in to intervene in terms of sleep changes. We didn't see that effect on the emotion regulation strategies, as Christine mentioned again. So interesting to think about why that might be as well.
So some other questions that I had in reading your article was about just how consistently these young adults were able to extend their sleep. There was a comment that in order to be included, they needed 20% of ESM or experience sampling completed. So what about sleep logs? What was the percentage completed, and how many days do you think that they met that 90 minutes or at least an hour extension?
I could try answering that one, Christina. Obviously, jump in if you have other things to add. So in terms of sleep log completion, we did actually see better completion of the sleep logs than of the daily emotion ratings. I think part of that is that we were only asking the sleep log once a day, and we're probably benefiting from that effect Christine mentioned as well, of, you know, the first thing you do in the day is pick up your phone and it's right there. Whereas obviously some of the emotion logs later on in the day, they were you know, active only for 30-minute windows. So it's quite easy to miss those, just, you know, maybe even in class and things when you're paying attention, hopefully. So yeah, so we did see good reporting of the sleep logs. We didn't do the quantification of how many. That's a really good question. How many achieved the 90 minutes, even within individuals or across individuals? I think we did see, you know, consistent effects across days. The way that we've analysed our data using this multi-level modelling approach would mean that if they had only sort of done it for the first day or so and then, you know, rapidly tailed off, the effect wouldn't have come out in our model, because we're modelling for days within participants. So it's kind of taking that into account. But yeah, that'd be a good stat to actually compute and know to hand. It would be, yeah, that'd be an interesting one.
I just think in all of our sleep extension, like test or app testing and that sort of thing, we use college students. They're the hardest. I mean, give me a middle-aged adult that has little health risk and they're really motivated, but the college students have so much going on. It's really impressive that they were able to do it even just for 1 week. So it takes a lot.
Yeah, for
They
sure.
have a lot happening. So some questions for Dr. Devine. I think another really unique thing about your study is that you had established parents and new parents, and you know, there's not as much research about established parents, but it looked like their health behaviors were even worse. They were less active, slept less. So tell us about what's going on there.
Yeah, obviously in our study, we just looked at moderate to vigorous physical activity, and we see it really does drop in established parents, more so even than in new parents. But they have higher light physical activity, probably chasing after a toddler or something, and the extra housework that comes. So another study that we did looked at the effect of housework on light and moderate physical activity across these cohorts. And we did see increases in certain types of housework, laundry, more cleaning and stuff that is associated with light physical activity. So we do see that the established parents are achieving more light physical activity, which is not terrible for health benefits. We know we can achieve health benefits with light physical activity. And then we see that the new parents, by the time they get to 12 months, they're almost matching the light physical activity of the established parents. So while yes, we get more benefits from the dose response of moderate to vigorous physical activity, and that's obviously an issue within Parenthood and some cases general society as well in some instances, but they are getting light physical activity. So it's something that's important to note. Obviously not part of this study, but part of one of the other studies from this data set.
I think in Kathy Lee's like really foundational work with Parenthood and with new parents and established, you know, the second pregnancy, the first pregnancy, people can rest and they can compensate, and when they have another kid at home, they have less flexibility to do that because they don't have that buffer. They have other responsibilities.
Yeah, exactly. You know, they have to, you know, maybe you're not supposed to lift too much during your third trimester, but you have a 26-pound toddler that you have to move around, and so you don't get as much rest in that period. And then, yeah, obviously they don't nap as frequently as the newborns, and you don't get that time off.
So as primarily a physical activity researcher, you know, what's your next step after this study? What are you thinking? Because I think in your paper you kind of were like, unfortunately, physical activity didn't work out, but we did find this relationship with sleep. So, you know, do you see incorporating sleep more into your work in the future?
Yeah, I think so. So this was the first foray really into kind of sleep. And one of my co-authors, they looking at doing some work together, looking at prenatal sleep as another option from a sleep perspective. In terms of parenthood and physical activity, there's so Ryan Rhodes on the paper, they're looking at family physical activity and interventions to help from that parenthood stage and that young kid stage to help improve that. It'd be interesting to include some sort of sleep, or maybe look at what strategies work for different situations from a sleep education standpoint, because I say cluster feeding will work for some babies, And some moms and dads, it won't work for others. So trying to figure out perhaps what strategies might be more effective for some situations. If you've got colicky babies or something like that, or if they won't take bottles, or if you're a single parent and don't have help at night, what types of things actually improve sleep, or actually, yes, I think what is the old piece of advice? Sleep when the baby sleeps. Well, it doesn't always work very well in reality. So trying to find out what actually works in reality, and then using that as a piece of advice as sleep when the baby sleeps. I think that would be kind of interesting going down that route.
And not necessarily for new parents, but what I think about as a clinician is I try to teach my patients that losing sleep affects emotion, and that you won't feel like doing it, but you need to get up and do it anyway. And that, that it makes exercise feel harder, but it actually doesn't change your VO2 max. So you should just make yourself get up and do it, and it's better for your sleep in the end. Yeah,
absolutely. And I think, I don't know, I think people, they'd say that, well, sleep when I'm dead, or, sleep is for the tired and wicked. And I don't know if you've ever heard those things, but I hear those a lot. And they just don't prioritize sleep. And yeah, part of the issue is the phone, people scrolling all night. There's an hour where you think I'll just look at it for 5 minutes. There's an hour. And I think if we can understand the importance of sleep, a healthier population, perhaps, it impacts our immune system and energy to be more physically active and to engage in our daily lives. Yeah, obviously sleep is really, really critical.
Mm-hmm. So going back to the sleep extension study, we have a question here about, were there any changes in sleep timing preference? Like, did you measure chronotype or the actual sleep timing from the participants following the sleep extension? So yeah, that's always a question. Which way do they extend?
Yeah, so our participants did both. There was a slightly larger effect related to bedtime. So I think it was it was 55 minutes. They went to bed earlier and had 44, 45 minute later wake time period as well. So slightly larger effect related to the going to bed. But it was in both directions. And we also did a nap counting analysis. I had maybe thought that participants might nap at the weekends or during the week, for example, but that wasn't particularly where they seemed to change. So it was in both directions with sleep time. We didn't actually take any sleep preference measures, but I think we had, from the we had participants at the time going to bed quite late, after 1 a.m. On average pre sleep extension.
And I don't recall, but what time of year were you doing this measurement? Was it during exams, or did you try to avoid those time periods?
Yeah, we avoided exam time periods, but it was, I think, Katie, can you remember the exact time?
Yeah, it was sort of April, early May time. It aligned for us with, the cycle of student projects. We had a couple of master's students signing up to help us out with this study. So it was that short window where they were working with us, and before the exams all got started. They were mostly recruiting from King's College in London, so on a kind of UK schedule. So yeah, that was the goal.
And we were quite concerned, of course, with not coinciding with major deadlines where the tradition would be not to go to bed early.
No late night cramming, hopefully affecting our data.
Did you receive any feedback from participants about what strategies they used, or whether they intended to continue this? Like, did they feel better if their emotions were trending toward improvement?
I think that's one of the tricky things that you miss out on when you do remote studies like this. I think one of the things I always enjoyed about in-person research is that you get to, have all those extra chats with your participants, after they come in for sessions. There's a lot of things you pick up on anecdotally. I think, as Christine mentioned, we did everything through this app. So it was sort of very constrained. What the communication was, very controlled, really great, for the rigorous scientific aspect, but less of that kind of anecdotal feedback and things. So no, we didn't get anything sort of, qualitative in that respect. Yeah.
So it's interesting. So they were recruited and enrolled from the app.
We did a little like screening beforehand, so they, screened through an online survey and things. But as soon as they were enrolled, yeah, they were put on the app, and everything happened on the app from there.
Mm-hmm. Cool. That's. I mean, that is the way a lot of people want to connect with research and healthcare these days. So it's incredible with very little effort that they increase their sleep that much.
Yeah, there are many like CBT based platforms that are doing, I would say, pretty well with engagement, like Sleepio, and where those fully automated procedures, I think that's kind of what we were thinking of would be ideal in these scenarios, because then you have something that's very, okay, we miss out on actigraph data, we miss out on debriefing, but it's extremely scalable. But yeah.
Mm-hmm. So for those of you who can see the chat, we just posted, there's a CE certificate code. You can download that. Use the following code to download your CE certificate. So if you'd like to earn CE for today's webinar, you can. So in our last couple of minutes, I just want to kind of open up to panelists as well. If you have questions, keep putting things in the chat, but feel free to ask questions, or if there's things that we haven't asked you about that you want to highlight about your studies.
Is there any thought to go back to the people to see if they're still sleeping a little bit longer, if they got a positive benefit? Touch base and see, did they stick with it a little bit? Even maybe if it's not 90 minutes, but maybe half an hour or 40 minutes.
I would love to do that. I don't think we've got ethical approval to, unfortunately. I think we really conceived of this as a feasibility study, and it went a lot better than we initially anticipated. And I think this is, we were kind of pleasantly surprised at our completion rates. And I think with that in mind, I'd love to see participants in 6 months or even in 3 months to see if they continued in any way with what they, because it is, with diets, with exercise, it's possible to follow things for a week. That's not a period that's insurmountable for a lot of people. But beyond that, it would be extremely interesting.
Yeah, I think for your scalability and reach, obviously, if it can be maintained from a new habit, let's say.
Yeah.
A week to form a habit is a little bit short, but if they can do that, that scalability and reach can have quite good impact. Like I say, without a lot of effort, really, from just using the app would be quite interesting.
Mm-hmm. Yeah.
So in looking at the graph too, I was wondering about, in our sleep extension research, we get a lot of people who sign up for it as short sleepers, and then we screen them out because they're not truly short sleepers. So in that baseline week, how many of them were over 7 hours, or did you exclude them if they were over 7 hours in the baseline?
We didn't exclude on that basis. No, we excluded if they report it. We sort of had in our study advert, what we were looking for, but not specifically, what the cutoff is on number of hours. So in the screener, we asked people how long they typically slept tonight. And so anyone who's reporting more than our cutoff, we excluded there. But yeah, Christine, it didn't occur to us, I don't think, to check what they were doing during the baseline week and check for any longer sleepers during that period, but we could have, and we could go back to the data and look at that as well.
No, I mean, they were under in that baseline week. It was like about 6 and a bit hours, and there was a standard deviation of about 1.7 hours, so there was variability. But in the sleep as usual group as well, there were 6.15 hours, and again with some standard deviation around that. So they were under the 7 hours as on average. We didn't exclude them, or take out people other than that.
Mm-hmm.
Yes.
And then, in the cohort of parents, it looked like the range was quite large for sleep. I saw it was like 2.5 to 10 hours or something. I'm wondering, who are these parents sleeping 10 hours? Or were those in the childless group?
I imagine those are most likely to be the couples without children.
Yeah.
I'd be surprised if there was a significant number of people that have kids that aren't or that are getting 10 hours, unless you've got, you know, a really heavy sleeping husband or something that, you know, can't bottle feed for some reason that doesn't wake up. I know I wake up when my partner gets out of bed, even just a little bit. So yeah, I imagine those are mostly the couples without children.
Did you collect any characteristics of the infants in this study?
Not in this one, no.
Because, you know, some infants are super sleepers and some are not.
Absolutely. No, but we didn't in this one.
What are the parental leave policies like for Canada? Are they a little bit more generous than the?
Yeah, I think Canada, you can take up to a year, I believe, in Canada, but I don't recall how much you get from a full pay. It's pretty decent. Certainly it's better than the States. I think the UK, you can take up to a year and you get some standard maternity pay, and I think you can get 4 months full pay and then maternity pay or some sort of combination. Yeah, I can't remember how much they actually get full pay or how much the paternity kind of federal paternity bit is.
Yeah, I was just wondering about the opportunity that, you know, some of your sample might have had to, you know, get sleep later on during the day, even though it wasn't an undisrupted period of sleep.
Yeah, I would think that most took, and I believe we have the data, I just don't remember off the top of my head. We did look at maternity and paternity leave, so if it was shared or if it was split or something like that, but every couple did take some, and most probably took as much as they could, to be fair.
Yeah.
Well, super interesting interaction of policy and, you know, partner support and that sort of thing. So, and really interesting statistical modeling on both of your papers. So, well, we're gonna wrap it up here. I'd like to thank all of our guests for coming and highlighting their papers in our journal and for this really exciting, interesting discussion today. So thank you so much for coming and for participating today.